Today we are going to discuss about dietary assessment. It's one of the method of nutrition status assessment. What is dietary assessment? There is a definition that dietary assessment is a systematic collection of and analysis and interpretation of information about food consumption to evaluate the nutritional status of individuals or population. Dietary assessment എന്ന് പറഞ്ഞാൽ ഒരു സിസ്റ്റമാറ്റിക് കളക്ഷൻ മാത്രമല്ല ആദ്യം ഡാറ്റ കളക്ട് ചെയ്യും ദെൻ അനാലിസിസ് ദെൻ ഇന്റർപ്രിട്ടേഷൻ ഓഫ് ഇൻഫർമേഷൻ അബൌട്ട് ഫുഡ് കൺസപ്ഷൻ. അപ്പം ഒരു ഫാമിലി ആയിക്കോട്ടെ അല്ലെങ്കിൽ ഒരു കമ്മ്യൂണിറ്റി അല്ലെങ്കിൽ ഒരു ഇൻഡിവിജ്വൽ എത്രത്തോളം ഫുഡ് കൺസ്യൂം ചെയ്യുന്നുണ്ട് എന്നുള്ളതിന്റെ ഒരു ഡാറ്റ സിസ്റ്റമാറ്റിക് ആയിട്ട് കളക്ട് ചെയ്ത് അത് അനാലിസിസ് നടത്തി അത് ഇതിന്റെ ഇന്റർപ്രിട്ടേഷൻ ചെയ്തിട്ടാണ് ഒരു ന്യൂട്രീഷൻ സ്റ്റാറ്റസ് ഓഫ് ഇൻഡിവിജ്വലെ അസസ് ചെയ്യുന്നത്. ദാറ്റ് ഈസ് ദ മെത്തേഡ് ഡയറ്ററി അസസ്മെന്റ്. Dietary survey എന്ന് വെച്ച് കഴിഞ്ഞാൽ it is a structured inquiry into the food supply, food consumption patterns, dietary habits and nutrient intake of defined group. അപ്പം ഡയറ്ററി സർവേയിൽ നമ്മൾ എത്രത്തോളം ഫുഡ് സപ്ലൈ ചെയ്യുന്നുണ്ട് എന്നുള്ളതും എത്രത്തോളം ഫുഡ് കൺസ്യൂം ചെയ്യുന്നതും ആ കൺസംഷന്റെ പാറ്റേൺ എങ്ങനെയെന്നുള്ളതും സെർച്ച് ചെയ്യുന്നുണ്ട്. Okay. The scope of dietary assessment encompasses both qualitative aspects and quantitative aspects, forming the foundation of nutritional evaluation. That means dietary assessment qualitative aspects വരുന്നുണ്ട്. That means ഫുഡിന്റെ ചോയ്സസ് കമ്മ്യൂണിറ്റീസ് അല്ലെങ്കിൽ ഇൻഡിവിജ്വൽസ് ഏത് ടൈപ്പ് ഓഫ് ഫുഡാണ് അവർ ചൂസ് ചെയ്യുന്നത് എന്നുള്ളത്, അല്ലെ അതുപോലെ ഫുഡ് പാറ്റേൺസിലുള്ള വരുന്ന ഹാബിറ്റ് എന്തൊക്കെയാണ് എന്നുള്ളത് അത് സെയിം. അതേപോലെ തന്നെ ക്വാണ്ടിറ്റേറ്റീവ് ആസ്പെക്ട്സ് ഉണ്ട്. എത്ര എമൗണ്ട് ഫുഡ് അവർ കൺസ്യൂം ചെയ്യുന്നു, ഏതൊക്കെ രീതിയിൽ ഏതൊക്കെ ന്യൂട്രിയൻസ് എത്രത്തോളം അവർക്ക് ലഭിക്കുന്നുണ്ട് അവരുടെ ഫുഡ് പാറ്റേണിലാണ് എന്നുള്ളതൊക്കെ അസസ് ചെയ്യും നമ്മൾ ഈ ഡയറ്ററി അസസ്മെന്റിൽ നടത്തുന്നുണ്ട്. Then what are the importance of dietary assessment? We can use this to assess nutritional status of individuals or communities. And also thereby we can identify nutrient deficiencies present them, and we can study dietary patterns of a community or an individual. Then we can plan when after we understanding about their patterns and their deficiencies, their present current nutritional status, we can plan nutrition intervention programs for the community or the individual. Then we can also evaluate food adequacy of that community. Here is main objectives of dietary assessment. First one is assess adequacy of food intake. അപ്പോൾ ഫുഡ് ഇൻടേക്ക് എത്രത്തോളം അവർക്ക് അഡിക്കേറ്റ് ആണ് ഒരു കമ്മ്യൂണിറ്റിക്ക് എന്നുള്ളത് നമുക്ക് അസസ് ചെയ്യാന്നുള്ളതാണ് ഫസ്റ്റ് തിങ്. അവരുടെ ഒരു റിക്വയർമെന്റിനനുസരിച്ച് അതേ പ്രകാരം ഉള്ള ഒരു റിക്വയർമെന്റിനനുസരിച്ച് അവർ കഴിക്കുന്ന ഫുഡ് അഡിക്കേറ്റ് ആണോ എന്നുള്ളത് അസസ് ചെയ്യും. സെക്കൻഡ് വൺ ഇസ് ടു ഡിറ്റർമൈൻ ന്യൂട്രിയന്റ് ഇൻടേക്ക്. അവർ ഓരോ ന്യൂട്രിയന്റും കാർബോഹൈഡ്രേറ്റ്, പ്രോട്ടീൻ, വൈറ്റമിൻസ് ഒക്കെ ഓരോ ന്യൂട്രിയൻസ് എത്രത്തോളം അവർക്ക് കിട്ടുന്നുണ്ട് അവരെ ഫുഡ് പാറ്റേണിൽ എന്നുള്ളത് നമുക്ക് ഐഡന്റിഫൈ ചെയ്യാൻ പറ്റും. And identify vulnerable groups. Vulnerable groups means ചില ഗ്രൂപ്പില് ചില കമ്മ്യൂണിറ്റിയിൽ അവർ ഫുഡ് പാറ്റേൺ ഭയങ്കര സ്പെസിഫിക് ആയിരിക്കും, ഭയങ്കര ചൂസി ആയിരിക്കും. അങ്ങനത്തെ സിറ്റുവേഷനിൽ ചില വൈറ്റമിൻസിന് ഡെഫിഷ്യൻസി വരാം, ചില ടൈപ്പ് ഓഫ് ന്യൂട്രിയന്റ് കംപ്ലീറ്റ്ലി മിസ്സിങ് ആയിരിക്കാം. അങ്ങനെയൊക്കെ ചിലയിടത്ത് ടോക്സിസിറ്റി വരാം, ചില മിനറൽസ് അല്ലെങ്കിൽ വൈറ്റമിൻസ് ടോക്സിസിറ്റി ഉണ്ടാവാൻ ചാൻസ് ഉണ്ട് ആ കമ്മ്യൂണിറ്റിയിലെ ഫുഡ് പാറ്റേൺ അനുസരിച്ച്. അങ്ങനെ അതല്ലെങ്കിൽ അവർക്ക് ചില ആൾക്കാർക്ക് തീരെ വൈറ്റമിൻസ് ഒന്നും കിട്ടുന്നില്ല എന്നുണ്ടെങ്കിൽ ഇതൊക്കെ നമുക്ക് മനസ്സിലാക്കാൻ പറ്റും. ദാറ്റ് ഈസ് മീൻ ബൈ ഐഡന്റിഫൈ വൾനറബിൾ ഗ്രൂപ്പ്സ്. നെക്സ്റ്റ് ഒബ്ജക്റ്റീവ് ഈസ് കമ്പയർ ഇൻടേക്ക് വിത്ത് RDA. നേരത്തെ പറഞ്ഞ പോലെ തന്നെ അവർ കഴിക്കുന്ന ഫുഡിന്റെ ന്യൂട്രിയൻസ് എത്രത്തോളം അവർക്ക് കിട്ടുന്നുണ്ടെന്ന് വെച്ചിട്ട് നമുക്ക് RDA ആയിട്ട് കമ്പയർ ചെയ്യാം. അപ്പോഴാണ് നമുക്ക് മനസ്സിലാവുക അവർക്ക് ഡെഫിഷ്യൻസി വരുന്നുണ്ടോ, അവരുടെ ന്യൂട്രിയന്റ് ഇൻടേക്ക് അഡിക്കേറ്റ് ആണോ എന്നൊക്കെ. ദെൻ പ്ലാൻ കമ്മ്യൂണിറ്റി ന്യൂട്രീഷൻ പ്രോഗ്രാംസ്. ഇത്രയും കാര്യങ്ങളൊക്കെ നമുക്ക് മനസ്സിലായാൽ നമുക്ക് അവരുടെ പ്രോബ്ലം എന്താണെന്ന് ഐഡന്റിഫൈ ചെയ്യാനും അതിനെ ഇന്റർവെൻഷൻ ചെയ്യാനും അത് റിമൂവ് ചെയ്യാൻ വേണ്ടി നമുക്കൊരു ന്യൂട്രീഷൻ പ്രോഗ്രാം പ്ലാൻ ചെയ്യാനും സാധിക്കും. Then we can evaluate dietary modification. That is a part of intervention programs. We can apply the dietary assessment in areas of community service. We can use in clinical nutrition in case of diseased clients, diseased patients. We are going to suggest modify their diet, and also using research studies related to nutrition and institutional feedings like Anganwadi, schools, gym, like that. and nutritional surveillance, and public health programs. There are different levels of dietary assessment. First one is family or household level. It means to assess the dietary patterns of a family or family, their consumption of food we are assessing. Second one is individual level. That means we assess the dietary patterns of single person or independent individual. Next one is institutional level, like hostels, hospital, prisons, anganwadis, schools. We are assessing the group of dietary patterns. Then national level, that means food balance and sheet overview we use. National level means a survey of our community. You can move into family diet survey. It means it collects household food consumption data to assess the nutrition status of the family as a whole. Its results are expressed as per capita intake, means that means per person or per consumption unit, allowing meaningful comparison across households of different sizes and compositions. ഒരു വീട്ടിലൊരു ഫാമിലി എത്രത്തോളം ഫുഡ് കൺസ്യൂം ചെയ്യുന്നുണ്ട്, ഓരോ ഐറ്റംസ്, ഓരോ ഫുഡ് ഗ്രൂപ്പ്സിലുള്ള ഓരോ ഐറ്റംസിന് എത്രത്തോളം എമൗണ്ട് കൺസ്യൂം ചെയ്യുന്നുണ്ട് എന്നുള്ളതിനാണ് ഇന്നത്തെ അസസ് ചെയ്യുന്നതാണ് ഫാമിലി ഡയറ്റ് സർവേ കൊണ്ട് ഉദ്ദേശിക്കുന്നത്. This method is widely used in protein nutrition surveys and community level dietary assessment programs. So it can provide a valuable data on food availability, consumption patterns, and nutrient adequacy at the household level. ഏതൊക്കെ ടൈപ്പ് ഫുഡ് അവർക്ക് അവൈലബിൾ ആണെന്നുള്ളത്, ഏതൊക്കെ രീതിയിൽ അവർ ഫുഡ് പാറ്റേൺസ്, ഏത് ഫുഡ് കൂടുതലായി കഴിക്കുന്നു, ഏത് ഫുഡ് കൂടുതലായി മിസ് ആവുന്നു എന്നുള്ള രീതിയിലൊക്കെ അവരുടെ ന്യൂട്രിയൻസ്, എല്ലാ ന്യൂട്രിയൻസും അതേ പ്രകാരം അഡിക്കേറ്റ് ആണോ എന്നുള്ളതൊക്കെ നമുക്ക് ഹോൾഡ് ലെവൽ അസസ് ചെയ്യാൻ ഫാമിലി ഡയറ്റ് സർവേ യൂസ്ഫുൾ ആണ്. There are two methods for diet survey. First one is Weinman method. Weinman method of diet survey involves actual weighing of raw foods on a given day. The investigator visits the household before the food is cooked and weighs with the help of grocer balance or a electronic balance. All the steps, that means only edible portions that will be cooked for the day will be weighed. Weighment of foods was being carried out 7 consecutive days. The method was known as 7-day weighment method. If it is carried out on 7 day, it is called a 7-day weighment method. 7 day surveys are logistically more difficult and time consuming. And also needed to record the number of family members present in the house. It is needed to record all the raw foods, that is edible portion of food, need to intended to cook for that whole day. Then after cooking and after cooking and after eating, and then weigh and record any leftovers after the meal. Convert food quantities into nutrient values using food consumption tables, and then calculate nutrient intake with recommended dietary allowances. So it is needed to calculate or record the amount of food they eaten from outside, and any supplementary foods given to the infants. And also, it is need to record any food leftover is eaten by their domestic animals, or otherwise it will be over expectation, over consumption will be recorded. And also, it is important to careful that that survey never carried out on a feast day or fasting day, or a guest is there, like that. Advantages of the Weightman methods are: it is the most accurate household dietary method. It measures actual food intake directly. It is useful for quantitative research studies, and it is suitable for in-depth nutrition research. It is the limitations of this method are: first one is it is very time consuming. It also require others help. That means labor intensive and it requires more person to collect the data. That's what it requires trained investigators. Only experienced one can do this survey. Then family cooperation is needed. It is a major factor. If they are not cooperating, we can do it effectively. Difficulty during festivals or fasting periods. I already said on during fasting period or festival period, we cannot get a correct actual data. And also, it is a high cost implementation method. This dietary consumption is usually expressed as per consumption unit, which represents the make of sedentary adult male. And a consumption unit is a standard measure used to express the food requirement of an household in terms of a reference individual. So one consumption unit is equal to sedentary adult male, that is reference standard. The consumption units are calculated based on the calorie coefficient suggested based on the calorie requirements for a different age, sex, physiological groups. The calorie requirements for a one consumption units are 2,400 kilocalorie. So it represents the food energy requirements of sedentary adult male per day. That is 2,400 kilocalorie. It is used to normalize and compare household food and nutrient intake across members of different ages, sex, activity levels. It enables calculation of a per capita nutrient intake within the household. A consumption unit table. We can watch what are the consumption unit of different age groups or physiological groups. For adult male, sedentary working adult male, it is one. That is one consumption unit. But for a moderate adult male, moderate working adult male, it is 1.2. Uh, then heavy working adult male, it is 1.6. That is consumption unit. Then adult female, sedentary working adult female, it is 0.8 consumption unit. And moderate adult working female, it is 0.9 consumption unit. For an adolescent, it is once the consumption unit is 1. For a children 9 to 12 years, it is 0.8. For a children 7 to 9 years, it is 0.7. For a children 5 to 7 years, it is 0.6. And 3 to 5 years children, it is 0.5 half consumption unit. And 1 to 3 years old children, it is 0.4. That means reference is a one consumption unit is a sedentary adult male. These values reflect relative food requirements used to calculate household nutrient intake per consumption unit per day. The total number of consumption unit in each family is first calculated based on the information on age, sex, activity, and physiological status of all the individuals in the family by using the table I showed in previous slide. The number of consumption units will be less than the total number of members in the family. We can calculate of each food per consumption unit as follows. There is a formula for the calculation of consumption unit per day. The food intake of per consumption unit per day is equal to total food consumed is divided by total consumption unit. We can work an example. First, we need to find out a family's total consumption unit. It is taken by we will assess who are the members of the family. Hope there is adult male, adult female, and child 3 years, and child 7 years. And the adult male consumption unit is 1.2. Then adult female is 0.9, and adult, just a minute. Adult female is 1. Adult male is 1.2. Then adult female is 0.9. 0.9. Then adult child for a child 3 years old, it is 0.4. 0.4. Then adult child for 7 years old, it is 0.6. These four values are when we added, we will get 3.1. Okay. So next we need to uh, calculate their consumption of food intake. The rice consumed is 400 gram. So rice per CU per day. So we measured the rice consumed that day. It is 400 gram. So rice intake per CU per day is equal to 400 divided by 3.1. It is 129 gram. This value is then compared with the recommended dietary allowances RDA to assess adequacy. Okay, I hope it is clear. This is second method of family diet survey, that is consumption expenditure survey. The consumption expenditure survey, in this, money is spent on all food and non-food items for a fixed period in the immediate past, usually for a 1 month, is founded by administration specially designed for coma. This is considered to be comparable to the results of Wayman Diet Survey. And the National Sample Diet Organization collects such information every 5 years. Then, in fact, the extent of poverty in the country is calculated based on this result of food consumption surveys. This result provide information of foods brought by family, which need not always mean actual consumption. That means the consumption and expenditure survey measures the amount of money spent on food purchased by household. The uses of the consumption of expenditure survey are the household food security assessment. Okay. Then poverty and economic analysis of the for the countries. And NSSO National Nutrition Surveys used this method. And also for the larger population and epidemiological studies, it is used widely. And also for food policy planning and interventions in country level, it is used. Dietary status of individuals at risk groups often require to plan specific programs for that group. For example, information of actual intakes of preschool children or pregnant women who are considered more vulnerable is essential to assess the actual deficit in the diets and to decide quantities of supplements to be provided in the intervention programs. So we will discuss the three types of method used to collect information on diet and individuals. Okay, that are 24-hour dietary record, food record, or food diary, and dietary history method. The target groups are, we are using mainly for the target groups are children and adolescents, pregnant and lactating women, elderly individuals, or patients with the diet-related conditions. The 24-hour recall method is used in large nutritional surveys to collect collect dietary intake of data of individuals. That is, what are the food they are eating on that day. That is in between 24 hours. This method, the individual is asked to record in so as much detail as possible of the food intake for the past 24 hours by interview or by completing the questionnaire. The respondent records what was eaten or how much food was eaten and how was the food prepared, when was it eaten, and other details related to food intake. So, while conducting the survey, both the respondent and the housewife is conducted. The data intake are assessed in terms of cooked food with the help of standardized measurement appropriate for the local conditions. So, we are collecting the by this survey, by this method, we are collecting the amount of food they are eaten. So, it is need to measure the cooked food. The steps in 24-hour recall is first interview the respondent, then record every meal. First, they interview the respondent using a specific perform or a questionnaire, then record every meal consumed. Other one thing, we can ask them, otherwise, we can measure the food items before they eat it. Then estimate the portion sizes and convert the cooked foods into raw ingredients and calculate nutrient intake. Then compare with the RDA. The advantages and limitations of 24-hour recall are advantages are it is a quick and easy to administer. And there's a healthcare low cost and suitable for large surveys. But the limitation is it depends on memory accuracy. 1 day or day not present usual intake, then possible under or over reporting. That means if the household housewife should be or individual should be remember correctly. And maybe 1 day dietary intake is not similar to another day. There is a error chance. Then it is possible under or over reporting. That means we can not get correct information on dietary intake. Next method for an individual diet survey is a food record or food diary. Food record or food diary method provides food consumption data of individuals. Under this method, the subject records at the time of consumption, the type of and amount of all foods and drinks consumed for a period of time usually ranging from 1 to 7 days. 1 to 7 days. And what are they eaten at what time? The amount of food they are eaten. The advantages of these methods are no memory bias. They are because they are recorded at that time. And it is accurate and should be a detailed records if they are doing it correctly. And it also captures the actual intake in real time. The limitations of the food record, it is time consuming for the participants. It requires literacy and numeracy skills for to correct recording. The participant, it is a burden for the participant, and maybe they feel like that. The risk of altered eating behavior during recording, and that means they are while recording, they are more careful for their on their eating and just modified as a healthy eating before uh, beyond their actual eating pattern. A dietary history methods yield an estimate of food and nutrient intake of an individual over a period of time. The period covered may range from months to 1 year at the most. Traditionally, the diet history approach has been associated with the method of assessing usual diet developed by a scientist. B.S. Burke. Burke's original method involved 4 steps. 4 steps. These are the collected general information about the subject's health habits. The second one is conducted 24-hour dietary record to get information on a subject's usual pattern of eating. The third one is perform a cross check on the data given in step 2. And fourth one is have the subject complete a 3-day report for verification. The advantages and limitations of this dietary history methods are the advantages it reflects habitual intake. And also it includes seasonal variations and also it can be detailed information on assessment possibility. The limitations are time consuming. It requires a skilled interviewer, which its intake may be overestimated. It is best used for long-term dietary pattern assessment in a clinical and research settings. Thank you for listening. If any suggestion or improvement needed for my lecturing method, please comment on below.